ऐसी फीलिंग्स आ रही थी कि चलो भगवान अभी ऊपर लेके ही जाए, और मैंने सारी उम्मीदें छोड़ दी थी।
मैं बहुत हैवी डायबिटिक पेशेंट था। डेली आई यूज्ड टू टेक 36 यूनिट्स इन द मॉर्निंग एंड 22 यूनिट्स इन द इवनिंग।
आई थिंक मैं 35 યર્સથી મેં મારી જાતને મિરરમાં જોઈ નથી.
Want Lopa to be healthy and laughing and happy, or you want a bedridden Lopa who will suffer because of her diabetes?
जब मेरे इंटरनल प्रॉब्लम्स थी, जो हर लेडी को रहता है मेंस्ट्रुएशन साइकिल का, मतलब जो भी पैड्स वगैरह चेंज करने का काम या मेरे को क्लीन करने का काम वही करती थी। सबसे बड़ा और बहुत ख़राब लगता था जब वो आने वाला होता था, तो मुझे इतनी टेंशन आती थी कि मैं अब अपनी लड़की को इसके लिए तंग करूँगी, और सबसे ख़राब मोमेंट मुझे वही लगता था।
मैं चाहती तो मैं अपना पूरा कंसंट्रेशन पढ़ाई में दे सकती थी, मम्मा को बोल भी सकती थी मम्मा मेरी पढ़ाई है, आई विल नॉट कम, मैं रात रात को तुम्हारे पास नहीं आऊँगी, कोई मेड रखो या कुछ भी करो, बट मेड वो बेटी का प्यार नहीं दे सकती।
In that time, one of the kidney was also removed. I was looked after by Dr. Chawla. He told me, you are sitting on a bomb. You can explode any day.
મને ક્યારે કોઈ ફ્રેન્ડ સાથે બેસવું હોય એવી ઈચ્છા થાય તો I can't sit with anyone because no one, not even girls also. They feel shame. I stood third in the college, but there are no friends.
I have basically been a type 1 diabetic since the age of 10. I had a kidney infection, severe kidney infection about 7 years back. Then a couple of years back I had multiple stones in my gallbladder, so I had to remove my gallbladder. And I know all this was related with diabetes. Every 6 months I would be in the hospital for some complication or the other.
I think Mamta is probably one of the persons who faced maximum difficulties, not only in terms of personal but physical problems as well. So the first time when she came to our clinic over here, she couldn't even walk. Somebody had to lift her. She had to be brought in on a wheelchair, and after walking 2 steps she just sat down. She couldn't take the 3rd step forward because it made her so breathless, and it was extremely difficult for her to move.
Mamta had sort of been planning for this procedure for a while now. She had thought about it, she'd spoken to people, so she knew what she was getting into, but she was scared. As every other patient is, she was scared. It's a major surgery. She wasn't sure what's going to happen, whether it's going to improve her lifestyle or worsen it. She wasn't sure.
Like when I met Namrata for the first time, she was only at home, like all the while. She never used to go anywhere socializing, nothing. No sort of activity, because she had lost all hopes that she would lose weight.
The surgery probably is just one part of the whole process, because after the surgery we are going to change their whole life. So right from their eating habits, their exercise, the way they look at life, psychologically, every way they change a lot. So they become like a different person from what they were before.
After we spoke to her, we explained to her the entire procedure as to what the surgery is going to do for her. The duration that it would take, what changes she might have to make in her entire lifestyle. She sort of started getting a little more comfortable.
Every follow-up that we did with her was very, very motivating. In the 2 years, I think we followed up with her almost 13 times.
Most of her issues, like starting, you can see around 4 to 5 sessions with Namrata, were only listening. It was like I sitting like a bin, listening to every of her talks and just taking in. So the sessions, then slowly as the session went on, as her confidence, as her motivation towards weight loss also started increasing.
She was actually targeting her weight as to lose at 100 kilos more. So that was a really long goal which she could actually have to achieve. So at every follow-up, I made sure that I give her a diet which ideally would help her to lose weight. Again, I pushed her for exercise, which she had to do it at least on a daily basis. I used to call her every 3rd day or 4th day to ask her that whether she's been doing a proper diet, what is told to her, and she's been going to the exercise, to the gym or walks, and what I've advised to her.
So in this entire process, we need to guide them with the diet, with the nutrition, because it's not only weight loss. we always want healthy weight loss. So at the end, patients should not be having nutritional deficiencies, they shouldn't be feeling weak and diseased. So there's no point in having weight loss which still has health issues related to that. We usually don't consider obese people as people who are diseased or who are suffering from some kind of a problem. We normally see it as some kind of physical deformity.
हर प्रोग्राम में लोग चाहते थे कि मोती भाई गाना सुनाए, तो मैं 2-4 गाने उनको सुना के थक जाता था.
Being in the fashion industry, I couldn't wear good clothes any longer.
मैंने तो समझ लिया था कि nothing to worry, we have to go.
And without talking to anybody, I just took the decision and I went ahead.
आप लाइफ जीने लग जाएंगे, लाइफ से तो वो लाइफ 100% अच्छी है.
नाउ तो डोंट आस्क मी यहाँ पूरा टाइम मस्ती मस्ती. वो कौन से गाने आते टीवी पे, शील सिंग, शील डांस.
It was so nice to know the changes in her life and she shared her experiences. So it was really great. We felt so great that she's got her youth back. She's got a new life to begin with. So it was really very good.
He's enjoying wearing all the clothes that he couldn't wear till date.
He has achieved what he wanted. So then it gives us also a positive kick that no, yeah, we have helped someone. He's very, very happy.
Have everybody is welcoming her like anything.
She went for a movie one day and she just called me up and said that, listen, I went for a movie. I mean, it was a very good moment for me because I wanted really her to enjoy this new life, what is given to her.
This is I think a second life. I think I born myself again. Credit goes to Dr. Lakdawala and definitely full team ने.
बोलते हैं कि जिंदगी एक ही बार मिलती है, लेकिन मुझे दोबारा मिली है डॉक्टर लकड़ावाला के थ्रू, डॉक्टर अपर्णा के थ्रू.
Daily morning, I pray to God and also to Dr. Lakdawala, but he has given me a second life.
If you ask me, Dr. Lakdawala is God because he has given me a second life. I am very happy.
Being a doctor or surgeon can never be too easy. Every day you go out to work, you realize that you've got to save somebody's life. And it can never be easy because you have so much knowledge, but you realize that you have very little yet and a lot more to learn. Every day you get up and hope that God gives you that strength to choose the right option, because the options are many and the choices are few. You know, I've done a lot of surgeries, most of them laparoscopic, and at best I can tell you that I've probably decreased their pain or their suffering, but probably never ever managed to change the whole life of a person until I did bariatric surgery. It was only when I did bariatric surgery that I realized that just with the simple option of doing one surgery, I actually put the smile back on somebody's face. I actually prevented someone from thinking that all hope was lost. I actually gave them that light that they were looking at the end of the tunnel. And when I met my wife Priyanka, she told me that what you're doing is actually giving life a second chance for some of these individuals.
किसी की मुस्कुराहटों पे हो निशान, किसी का दर्द मिल सके तो ले उदार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है.
किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम.
Just say yes to life. Go Cinnamon. Transforming today into a better tomorrow. Go Cinnamon.
Enjoying the joys of life. Go Cinnamon.
Don't worry, be happy. Go Cinnamon.
Where there's a will, there's a way. Go Cinnamon.
Yes, you can. Go Cinnamon.
Be the change that you want to see in the world, as nothing great was ever achieved without enthusiasm. Therefore, go Cinnamon.
Give life another chance. Go Cinnamon.
रिश्ता दिल से दिल के एतबार का, जिंदा है हम ही से नाम प्यार का. रिश्ता दिल से दिल के एतबार का, जिंदा है हम ही से नाम प्यार का, कि मर के भी किसी को याद आएंगे, किसी के आंसुओं में मुस्कुराएंगे, कहेगा फूल हर कली से बार बार